Good morning, everybody. We're going to talk about spike protein syndrome and post-long-haul COVID today. It's been a while since I've talked about this little viral pandemic, so I thought I would give you an update. There's a press release that came out 2 days ago that I thought was kind of interesting. I do know quite a few people that have had what they think is long-haul COVID syndrome. In other words, they've had some health effects from having coronavirus. And then I know several that have had post-vaccine problems. This is the, not website because he didn't do that. This is based on Linus Pauling's research, the vitamin C guy from years ago. So really, we're continuing to have vaccinations. President Biden wants 70% of Americans vaccinated by July 4th. I read this morning we're probably going to hit 67%. So there, and we were, I did a class in April where, as of March 3rd, there'd been 98,000 adverse events reported to the CDC, and about 10,000 deaths overall. What I do not remember if that was United States deaths or worldwide deaths after vaccination, and then I for the second time. So they had COVID, got vaccinated, and got COVID again. So you can debate the degree about negative outcomes. It's pretty minimal. And of course, everybody has to make a decision as to whether or not they're going to have a vaccination. But this is an emergency use clause from the FDA. This is not an FDA-approved, none of them, vaccine. Pfizer has applied for a rapid process of FDA approval, which typically takes about 6 months. They're trying to get the FDA to approve their vaccine, I think, by July 1st. So there is no question that there's been some diseases if we're at 60% of 331, well, I guess I'm not paying attention to children, but 60% of adults over the age of 18 have been vaccinated. So the risk of vaccination, side effect and adverse event is still pretty small unless you're a person that got the vaccine and you got an adverse event. So that's kind of the debate. The people that are kind of on the fence about being vaccinated, and there's a lot. So probably 30 to 33% of people are on the fence as to whether or not they're going to get this vaccine, and then which one. I mean, now there's several available to you. So what are the the debate is the clear-cut side effects versus in my little circle. I've got 3 people that had COVID, got vaccinated fully, and then got COVID again. So, and then we have the Delta variant of this virus that's starting to worm its way around the world. So the Delta variant, I've read both yes and no that the current vaccine would protect against the Delta variant, but vaccines mutate. So is this going to be like the flu vaccine where you have to have a COVID-19, well, not COVID-19, do you have to have a coronavirus vaccine every year or every 6 months? And so physiologic impact appears to be doing far more harm than good. So you want a spike protein in this virus. If you look at the graphic I put up before class an hour ago, you have the virus itself, the virion, and then you have the spike proteins, which is the spike protein surrounding the virion, which is what's attaching the cell walls. Okay, and so the spike protein portion of the vaccine is designed to get you a COVID antibody induction from your immune system. And so the introduction of the spike protein appears to be fueling ongoing replications with a continuing presence inside the body for an indefinite length of time. Not staying in your arm and waiting for your immune system to create antibodies against coronavirus. It's traveling through your bloodstream. So if you think about a COVID virus entering your body through your airway, it's really a central sphere of a viral protein surrounded by these little spear-like appendages known as spike proteins. And so they're kind of like the quills on a porcupine. And since, just like porcupines stab victims with their quills, the spike proteins penetrate cell membranes throughout the body. And after that occurs, protein dissolving enzymes become activated, the cell membrane the cell is hijacked ramps up. So lots of research focusing on the spike protein and then examining vaccine side effects. As of 2020, even back to the spike protein research can this is the second SARS coronavirus epidemic that we've had. The first was in the early 2000s. So the spike protein first attaches to the angiotensin converting enzyme 2 receptor on a cell wall. We talked about that over a year ago. So it's a receptor in the cell membrane. Angiotensin converting enzyme 1 is the most, leads to angiotensin. Is involved in dilation of blood vessels. Okay. So the initial binding step triggers the subsequent consequence of events that brings the virus into the cell. So there's activation of the spike protein, breakdown of the cell membrane, and then the virus gets into the cytoplasm. And if you block that by competition or you prompt enough displacement with appropriate therapeutic agents, the virus cannot get into the cell at all. The infectious process stops, and the immune defense of the body are freed up to mop up, metabolize, and eliminate the viral pathogens, or even just the spike protein alone if it's no longer attached to the virus itself. So ACE2, the receptor, is found in cells throughout the body. After pathogen inhalation. And ACE2 expression is also high on the alveolar epithelial cells of the lung, so the small sacs through which air, CO2 and O2 is exchanged on a cellular one cell layer level. And then the cell membrane virus, once it's attached to the membrane, can begin the process that eventually results in the severe acute respiratory syndrome, or SARS, that's seen in clinically advanced COVID infections. Okay? So the SARS presentation manifests most clearly when the degree of oxidative stress in the lungs is very elevated. And you've heard me talk ad nauseum about oxidative stress. Okay, so the referred to as cytokine storm. And if that's left unchecked, invariably that leads to death. Okay, so there's more concern now, or increasing concern, looking at just the presence of the spike protein in the blood itself unattached to the virus following vaccination or potentially following coronavirus infection, with cure, I guess. So supposedly intended to initiate an intended immune response from the vaccine. Spike proteins are disseminating throughout the body rather than staying just where the injection is placed, while the immune system evolves. So ideally, you would want it to stay in your arm while your immune system develops antibodies against themselves, even if they're not attached to virus particles. That wreaks havoc inside those cells and kind of ensures that there's an indefinite presence of spike protein throughout the body. And remember, oxidative stress, so acute stress, SARS, or chronic oxidative stress, chronic disease, and chronic inflammation. And so it's also been suggested that fair amount of spike proteins are just binding the ACE2 receptors, not proceeding any further into the cell, but blocking or disabling normal ACE2 function in a given tissue. And so when the spike protein binds to a cell wall and stops, the spike protein serves as an antigen, which then initiates an autoimmune response, so an antibody or antibody-like response to the cell itself. So in other words, you're creating autoimmunity. Autoimmunity is an immune system function that's attacking your own body. Antibodies against your own cells because the spike proteins are just sitting there on the cell wall. So that can lead to a wide variety of autoimmune qualities. Okay, and then another worrisome property of the spike protein is that itself, it appears to be highly toxic. So the spike protein itself appears to be toxic. So it's an intrinsic toxicity, and then the ability of the spike protein to replicate itself indefinitely within cells, if it enters the cell, probably represents the way in which the vaccine can inflict its worst long-term damage, if there is damage from a vaccine. So production of that toxin can continue indefinitely without with some kind of spike protein or COVID vaccination, or those that have had coronavirus and survived and got through it. So we don't understand, certainly I don't, but researchers don't completely understand or have worked out what this is, but there's an increasing occurrence of post-vaccine clinical complications that's fairly clear-cut and is being addressed as rapidly and effectively as possible. So disruption of ACE2 receptor function in so many areas of the body has resulted in an array of different side effects, and such clinical complications are being seen in different organ systems and areas of the body, and they can entirety of the virus particles along with the spike protein during the initial phase of infection. So three spike protein syndromes are an active COVID-19 infection, which also includes the virus itself, and then number two, the long haul COVID syndrome, which is still being, gathering data, working out what that means. Like I said, I've heard from several people that have had coronavirus, got through it, survived, but they're having all kinds of health and chronic health problems. And then the third spike protein syndrome is in response to a spike protein laden vaccine. So what's been reported post-vaccination and then long haul pulmonary system, lungs, and then pulmonary thromboembolism. Okay, so pulmonary embolism, and then lung tissue damage, possibly possible pulmonary fibrosis, which you kind of see with coal miners. Okay, then increased venous and arterial blood clots. Diabetes is higher. Type 2. Type 1 is autoimmune. And then neurologic complications, so encephalopathy, brain pathology, as well as seizures and headaches, neuromuscular disease, and also hypercoagulability, higher blood clotting, and stroke. Most strokes are from blood clotting. And then gut dysbiosis, so leaky gut syndrome and gut is your second brain, and so a lot of chronic disease states and chronic inflammation states can be headed off by fixing leaky gut and gut dysbiosis, and then inflammatory bowel disease, leaky gut as well, kidney damage, impaired male reproductive capacity, so there have been reports of lower sperm counts in men, skin lesions, other cutaneous manifestations. A nurse friend of mine had a total body skin reaction, was reported to the CDC, one of those 98,000 cases. She got her second, I think she got her second shot and got this skin thing, total body erythema, redness, rash, pain, and then general autoimmune disease, hemolytic anemia, and liver injury. So what do you do about it? Is there a clinical protocol to stop the ravage of a persistent including the periods after active infection, and then the long haul COVID, and then during ongoing spike protein presence, secondary either to chronic COVID infection or resulting from a COVID vaccine administration. So you have to take into account expense and availability, compliance. They all play a role in determining what treatment the given patient's given, and of course, to discuss all this, you should talk to your doctor or functional medicine doctor. So not one specific protocol may be appropriate for every person, even if they have the same pathology. So the best protocol would be to use all the options we're going to go through, but if the entirety of the protocol is not feasible or possible, the combination of two Delta virus running around. I gave you a list last March of 6 supplements to help protect you against COVID-19 viral infection, and they remain the same. We did a whole class on several of these actually. Okay, so therapeutic agents and the mechanism. So the first that's on this press release is hydrogen peroxide nebulization. There's a whole Facebook page on hydrogen peroxide or nebulized hydrogen peroxide. You can look it up. There's lots of information on there. Ways you can do that that's safe. So hydrogen peroxide eliminates acute COVID pathogen presence and any other chronic pathogen colonizations that persist in the area or general tract, lower digestive tract, and a reduction in inflammatory toxins. Okay, so even advanced COVID-19 infections have responded to hydrogen peroxide. So I use it on my counters all the time. It just kills bacteria and viruses. That's what it does. And hydrogen peroxide is very helpful with your immune system to fight off things that cause oxidative stress and chronic inflammation. Vitamin C, of course, this is from the Linus Pauling Institute, which is now the Orthomolecular Association. So this is synergistic with hydrogen peroxide. So vitamin C gives strong general immune support. It supports optimal healing of damaged cells and tissues. It may be the most potent antitoxin ever described in the medical literature. and there are no reports of it failing to neutralize any acute intoxication when it's given appropriately. This will take a physician oversight because quite often, especially if you have severe infection, China has been using massive doses of vitamin C intravenously for over about a year, just about a year right now. So we're talking about 25,000 milligrams of vitamin C given intravenously on a daily basis. There's oral forms, there's liposome encapsulated oral forms, which can be taken without an intravenous line being put in. But vitamin C could prove to be of enormous protective and healing capacity with COVID patients and vaccine recipients. So the recommendation has been from these protocols, most people take 500 milligrams of vitamin C a day, at least 3,000 milligrams a day for most protocols, and up to 10,000 milligrams a day. Hard to do because you get gastrointestinal side effects, so you kind of have to work up to that. So 3,000 milligrams is kind of the remember, vitamin C is, if you get infected, your vitamin C depletes. So you get vitamin C deficient pretty quick and you get scurvy. So you have to get sick, even if you have a cold. The big fight with Linus Pauling is he said that it would prevent or cure colds. Well, it doesn't do that except unless you're like a mountain climber or a high altitude athlete. That it works. But vitamin C does get depleted, and you get kind of a relative scurvy type thing. So if you do have a cold or the flu or whatever, you have to increase your vitamin C to replace what the vitamin C that's fighting off the infection. Ivermectin, it's an antiparasitic worm antiviral property drug, and it binds the ACE2 receptor site that the spike protein needs to bind to produce to proceed with entry into the cell and then replication of viral protein. Okay, so under some circumstances, the binding of the spike protein to the ACE2 receptor does not activate the enzymes needed to enter the cell. So it may be that ivermectin pushes down those activation proteins, and it might also competitively displace the spike protein from the cell walls. The FDA just put out 15 hours ago now, that you shouldn't use ivermectin for anything related to coronavirus or prevention of coronavirus because it hasn't been tested. Well, there's some studies. They're in this press release. They're not, the N number is not huge, but neither is the N number, so the number of participants in vaccine trials. You know, for I think 15,000 for Pfizer, that was their N number, 15,000 subjects that volunteered to get this this new vaccine that we're now unrolling into over 200 million arms in this country based on an N number of 15,000. So the ivermectin numbers are way lower than that, but they've been showing some antibiotic that I'm going to not name by name that was so controversial last April, still showing effectiveness in the trials that I'm seeing. They're not being done here, they're being done across other countries, Spain, China. And the way it works is zinc ionophoricity. It's a zinc ionophore. So it increases intracellular zinc levels, which can inhibit the enzyme activity needed for viral replication. Okay? And so getting zinc into a cell requires a zinc ionophore. Those two antimalarial antibiotics will do it. The next one is quercetin, which is also zinc ionophore. It's over the counter. It gets zinc into the cytoplasm, the goo inside of the cell. And so it blocks the binding of COVID virus spike proteins to the ACE2 receptors also. So that's quercetin is also blocking that attachment to the cell wall, as well as bringing zinc into the cell. And then that impairs the spike protein virus entry into the cell, or it impairs the spike protein alone from entering the cells, is the idea. So if you just have spike proteins running through your blood, quercetin theoretically could block spike protein from attaching to cell walls. Okay? And then there's a whole bunch of other bio-oxidative therapies. So ozone, there's ultraviolet blood irradiation, there's hyperbaric oxygen therapy, in addition to hydrogen peroxide nebulization and syndrome in patients with ongoing potential vaccinated generated spike protein syndrome. So they may just be as well as for dealing with spike protein as with the intact virus, but that remains to be determined. That hasn't been figured out yet. And then the baseline vital immune support supplementation, which we talked about last March of 2020. So it's hundreds, maybe even thousands of quality vitamin, mineral, and nutrient supplements capable of making some contribution to optimal health and minimizing the chances of contracting any kind of infectious disease. Okay, so you got to take into the decision the expense and the health impact and convenience. But the baseline vital immune support supplements are vitamin C, vitamin D3, magnesium chloride, vitamin K2, zinc, and even low dose, so 15 to 30 milligrams seems to be helpful. And then an iodine solution or supplement such as Lugol solution or iodoral. And there's all kinds of guidelines. I can put up a link on the type of supplements for immune support protection and protection from infectious disease, really. So to recap, so even as this pandemic seems to be subsiding, we do have a Delta variant that's worming its way throughout the world, but we now have chronically ill long-haul COVID patients and maybe side effects of COVID vaccination from spike protein syndrome. So they're characterized by a persistence of the spike protein and the negative impact from oxidative stress on different tissues and organs in the body, especially if spike proteins are attached to the cell wall, causing your immune system to think your own cells are pathogens. So what you want to do is neutralize the direct toxic impact of spike protein while working to block its ability to bind the receptors needed to hijack the metabolism of a cell into making new viruses and or more spike proteins. And at the same time, treatments work with a functional medicine doctor, somebody that's really kind of researched this. There are things, there are some over-the-counter things that you can do, and I have a coronavirus protocol that I put on Fullscript last spring. They're all in there. There's about 6, and you don't have to take all 6. So that's the class for this morning. And I will be talking to you either tomorrow or Friday. I've got some other kind of interesting things. That's all I'm going to say about vaccines. I'm not telling you to do it or not do it. I don't have the ability, nor do I want to recommend one way or the other.